Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach. And this is another episode of Dadvice TV Live. Now, for those of you that are new, say hello in the comments, like Joy right here saying hello. Hello, Joy. And introduce yourself. We have a great community here that's very supportive, positive, and helpful. And for those of you that are new, let me introduce myself. My name is James, and I have kidney disease. I was diagnosed about a little over 2 years ago with stage 5 kidney failure. Now, I've worked with my doctors, with a renal dietitian. I got my blood pressure under control. I started walking and exercise. I started eating much better, and I have improved my overall health, which has helped me to improve my kidney labs. And more importantly, get rid of all those nasty symptoms that I was suffering. Today, I am considered stage 3, but I'm not too set on those stages. I'm just really happy that I feel great and I am not letting my kidneys hold me back. Now, tonight, we're going to talk about how in the heck do you find a good nephrologist, otherwise known as a kidney doctor, because that's really, really important to help you in understanding kidney disease and managing it so that you can have the best life possible. Now, here with us to talk about it, my co-host tonight is Interventional Nephrologist Dr. Cawsom Butt. Hey there, Doc. How you doing?
How you doing, guys? How you doing?
Hey, introduce yourself to all the new people and let them know where they can find you. Because you know they're going to want to look you up after this.
Yeah. So I'm Dr. Cawsom Butt. I'm a kidney doctor, nephrologist, and actually interventional nephrologist in San Antonio, Texas. I love educating patients. I like breaking it down simple. I do videos online on YouTube, Facebook, LinkedIn, Instagram. You can find me on all those platforms at Cawsom Butt MD, but also my YouTube channel is Your Kidneys, Your Health, and the audience here at Dadvice TV has really helped grow that channel for me. I'm over 1,000 viewers, 1,000 subscribers now. So if you guys can go over there, just like that page or subscribe to that page.
Awesome, over 1,000. Boom, awesome.
Yeah, it was hard. It was a hard hurdle to get over for some reason. It just like slows down for a bit, and then now it's finally picked up a lot. But yeah, James, you and your whole crew has really helped out there, and I love the engagement from your whole the Dadvice groupies. I love it, so yeah. It's really fun.
Yeah, and your videos, for those of you who have not been over to Your Kidneys, Your Health, the YouTube channel and his Facebook page, go over there. His videos are educational. They're short and to the point, which is a challenge for me. Everyone who knows me knows I'm a talkaholic, and there's humor in there, which is something I like to inject into my videos too, because kidney disease is gloomy enough all by itself. So I like to kind of approach things with a little bit of humor to help lighten things up and make it a little more positive.
Yeah, and I agree. Like just adding that bit of humor, add some like realism to yourself as the person presenting, but also makes it enjoyable for the person watching. And so and I recently did a video, by the way. I released another video today, but I did a video of 6 things your kidneys do. Your kidneys do a whole lot, guys. So check out that video. You'll be surprised how much your kidneys actually do. It's not a simple organ like the heart or the GI tract or all that stuff. It's actually very, very detailed. So you need to check that out and go from there. But yeah.
Yeah, you did a premiere on that on YouTube. I saw that while I was working.
Yeah. Well, I did that last week. I did a video today. This one you're going to find boring. It's about 20 minutes, but it's about where kidney health is going in this country and how they're going to change how they pay doctors. So they're going to make us actually care about the outcomes of kidney disease, meaning the longer lifespans, slower progression of kidney disease, rather than just paying us to see you guys. So it's an interesting take. They're going to incentivize more at-home dialysis and kidney transplant. So this is going to be a life changer. And it's a 20-minute video. But it's kind of boring. It's a policy thing, but it's really interesting where kidney health is going to go. And everyone out here that is not on dialysis, you may have a completely different experience than people before 2020. After these laws get enacted and everything.
Yeah, and that actually bookmarks our conversation tonight about finding a good nephrologist, aka kidney doctor, because once you're diagnosed, that was one of the first things I was wondering. Now, of course, I was in the ICU when I was diagnosed. I had a lot of problems. I didn't, talk to my doctor about the symptoms when they were appearing. I waited until things got really bad. But I was wondering, is this doctor here in the ICU, is it a good nephrologist or not? I'm real nerdy. Yeah. I wanted to look up reviews and stuff.
Yeah. So in that situation, guys, like what we're going to be talking about is outpatient, meaning in the outside when you're, at home and going to see a doctor in the office. In the hospital, you guys can look up reviews and all that stuff, but I wouldn't be too picky in the hospital, unless, of course, you have a really bad experience there. Because there are only a few, like, say, nephrologists that may go to that hospital. If you're in a small town, that may be the nephrologist. You see what I'm saying?
And there was no way that I could say, hey, doc, I'd like a different doc. No.
Yeah.
I was in bad shape. They were doing a great job keeping me alive, getting me healthy.
Yeah.
But once I got
absolutely.
Out, then I was like, hey, I need to see a nephrologist on a regular basis. Will that nephrologist be my nephrologist, or is there somebody else better?
And that's a good transition.
You can't go to Nephrologists R Us and find them.
Yeah, there are avenues out there for you to find a kidney doctor. Before we even talk about how to find a kidney doctor, I want you guys to know you as patients have power. Okay, you do not have to see someone you do not like. And I've known people, including people in my family, that see doctors they don't like because they were told by their PCP to go there, or they were told by their insurance company this is covered. Oh, he has my records, therefore I have to stay with him. No, you have the power at all times as patients. Okay, so if you have a problem with that doctor, you don't like him, not responsive, maybe you just don't click. He may be a bad doctor, but you and him don't really, or you and her don't see eye to eye about things. You can switch. And you can move, and you can fax or email records. So don't think you're trapped with one doctor. Always remember, you have the power to change, move around, do things. Now, there are some people that change way too much. So I don't want you to be that person. You see what I'm saying? I don't mind you dating one or two, but don't go all around town to every nephrologist and just be like, I want the answer I want to hear. I don't want you to be that person either. You see what I'm saying?
Right.
Trying to get that second opinion, third opinion, fourth opinion. It's like, no, dude, you have CKD. At a certain point, you have to understand that. Just make sure, what I've realized with me is, like, if you explain it to them properly, that this is why you have kidney disease, this is your labs, this is your lab from 2 months ago, and this is what's going on, then they more understand it. But some people do become in denial, so.
Yeah, well, and that really is part of what makes a good nephrologist, is someone that you can communicate well with. You understand each other. The doctor's talking on your level. They're giving you the right amount of information that you want, and you feel comfortable with them to where you're going to share stuff, because you have to not hold back with your doctor. If you have a weird symptom, you got to tell them, Doc, this is going to sound weird, but here's what's happening. And that's just part of that relationship.
Absolutely. You got to be open and honest about what's going on with you. If you're having shortness of breath or chest pain or some swelling or whatever it is, be honest with the doctor. If you're having nausea, vomiting, your appetite's decreasing, and he notices, hey, your kidney function's getting worse, you may be dehydrated. That's kind of crucial. You got to remember, as kidney doctors, we can't ignore other organ systems or other things that are going on. We literally have to know almost everything about you when you come to us, because the kidneys, as the filter, are the canary in the coal mine and can be affected by everything that's going on. So always be honest and open. The other thing I would say, be honest about if you're taking your medications. If you're not taking your medications, dude, just be honest. Just be honest, because if you're on 2 blood pressure medications, your blood pressure's not controlled, I would hate to give you a third if you're not even taking the first 2. Do you see what I'm saying? Just be honest. You're not in the principal's office. You're not going to get in trouble. You see what I'm saying? But the honesty really helps. It really does, because I know what I'm dealing with. I can put in my note, attempted to clone blood pressure, patient not taking the first 2. Because if you were to take all 3 blood pressure medications in that scenario, your blood pressure may tank, you may pass out. You see what I'm saying? So there's a lot of things you just need to be honest with. And you should expect that same honesty from your physician as well.
Yeah, and the comment about not taking their medication is very, very common, and people don't tell the doctor. And my doctor, my primary care physician, awesome dude. One day I'm going to get him on here. You can't lie to him because he's like a human lie detector. Now, I do take my medication. I'm very good at that because I know how important it is in order to keep myself healthy. But he'll say things like, how are you doing with your diet? And he's talking about weight loss. And I may stretch the truth a little and say, oh, I'm not doing too bad. And he'll say, no, don't be lying to me. I've got eyes. I can see. You are kind of doing bad. Here's what we need to do. And he works with me kind of like a coach to help me with those challenges. And the more honest I am with him, the better he can help me.
And that's how I feel as well, too. When I have an engaged patient and they're interactive and they're wanting to know things or telling me things, guess what? That makes me more interactive, right? Like I've had those patients where they're like, I'm fine. Okay. This and that's it. That's the conversation ends. You see what I'm saying? So the engagement goes both ways. You can't just expect your doctor to be like, blah, 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 blah. All this stuff. You have to want to ask those questions too. And again, those are questions, I've actually done videos on that too. What to ask your kid. Well, we did that before. We've done it here.
Yeah, we talked about that.
We talked about that here. Yeah. That's what I get my stuff and your stuff all mixed up in my head now. But like what to ask your kidney doctor, things like that you may want to check out James's video on that, because those are important because those empower you. So you know what to actually, what to look for. So, but
So let's talk about how, because the relationship's important. So it is important not to just randomly, I almost said look through the phone book. Those, I don't even know if those exist anymore, but you just can't randomly pick a nephrologist and assume, hey, we're gonna be the best of friends. Everything's gonna be great. They're gonna have the hours I want and be a short drive from me. You really got to work to find all those things and get them all, to click on or check all the boxes. So what are the things you recommend to help someone find a great nephrologist?
So right off the bat, I would start off by making sure you're actually seeing a PCP regularly. Okay. Annual visits, even if you're healthy, just go see an annual visits. That's to make sure your kidney function is doing well. Because once you know you have kidney disease, then you can refer out. Like I've had people think they have kidney disease because they have back pain and then refer themselves to me and then nothing's there, right? So I would definitely start out with the PCP first. If you like your PCP, guess what? That if it's a good PCP, he's probably going to actually give you a good kidney doctor too. You see what I'm saying? So I would definitely talk to your PCP first. After you talk to your PCP, and let's just say you're looking for other ways to look for one, make sure they're covered by your insurance carrier. That's a big thing, guys. You don't want to be out of network or other things, to make sure, that you're covered. Then guess what? We have access to, and we do it all the time. Google them. Google them. That's one option there.
Google's not good for learning how to take care of kidney disease or what supplements to take, but it is good for finding a doctor. And I want to inject one explanation real quick. You and I know what a PCP is, but I had a hilarious email earlier today where someone was mistaking it for a different type of PCP. Not the one we want. PCP is your primary care physician, AKA your family doctor.
Yeah. And by the way, you have an audience in England, so they call them GPs out there, I think, right? So they call them GPs.
I have no clue. There we go.
Yeah, I'm international, dude. I'm international, so I know. And you got if those of you out there from England or even outside, tell us. Is that I think it's GP out there. But anyway, so what were we gonna say? Make sure they're covered by your insurance. Then of course you can Google them. Okay, now be careful about Google. Okay, be careful. I myself have been very cognizant of it, and I have done myself to create a good online profile for myself. That way, but some physicians don't. And it's not because they're bad doctors, okay? So a lot of those physician review sites, what I've seen, they're only as good as the amount of people that go see the patients, see their website. Do you see what I'm saying? So some of those physician websites you'll go to, and you're like, there's one review, and it's a negative review. And you're like, oh, guess what? that one patient that doctor had. He could have been like the perfect doctor, but had a bad experience with one patient, and all of a sudden they're putting their nonsense out there on oh my god, on
whatever the site is. But it's also easy for us when I'm upset. It's easy to pick the phone up and complain, or to go online and complain.
Yeah.
But when we get great service, we're less likely to take the time and make the effort to post a great review. So I always think about that when I see reviews. I kind of remember negative ones are easy to get. Good ones, you really got to work for those. So just seeing a negative one isn't going to affect me too much.
And guys, we're all on Amazon, right? We're all on Amazon. So when you're looking at a product on Amazon, you want to make sure that product has like maybe 10, 15, 20, 1,000 reviews, right? That way you can truly gauge where that product stands, right? So if that person has one review that's negative, is that person really bad? Or even 2 reviews, is that person really bad? It's hard to judge, but make sure whatever review site you have, they have numerous reviews of that physician. That way you're judging them. You would hate to, like you're in that hospital and you see that one bad review of that nephrologist and you're like, oh my God, he's a horrible doctor and he's saying me. You just shouldn't be like that. So you guys got to be, you got to be, cognizant and have a good BS filter out there, guys. Have a good BS filter and understand that, when you're looking at this stuff, you got to make sure to look at it with the grain of salt. Okay. Now, some of the review sites I would definitely recommend out there. One is Google itself. Sometimes the physician or the physician practice has a Google business account, and therefore will have, ratings on there, right? People. So you can actually review the practice or the individual physician, and you can get to know them, right? The other thing you can do is a popular one, health grades. Health grades is a big one. So health grades, you may want to look on there. Vitals is another one. Vitals is a big one as well too. What else is there? WebMD has some reviews as well too. And then of course you can always go to say social media, because a lot of people do have their own accounts, like myself, obviously, have their own accounts on social media. Therefore, you do get reviews on there as well. Facebook, LinkedIn, not everybody has a YouTube channel, so but certain ones, they do have reviews, and even then, like with regards to social media, if the doctor itself does social media like myself, you can get to know that physician before you even go in. So that's super cool, because I have met numerous people, patients and otherwise, that have literally said to me, hey, I feel like I know you, but I've never met you because of your videos. You know what I'm saying? Like, I know you. And I'm sure you get the same, James. Like, they think they know you. And it's cool. It's actually pretty cool. You get to put your first face forward. You get best face forward. And you get to interact with people, and they get to know you and feel comfortable with you when they come into your office. Because it's such an intimidating experience for a patient, right? So that's why I like social media from that perspective. Also, you get to know what that patient, that physician's about. If they're on social media and posting nonsense, whatever it is, you may not want to go there,
And for me, the social media part lets me kind of know their style of communication. And if they're, we've all seen the monotone, boring videos out there. Yeah. And then for me, that's not the kind of doctor I really engage well with. I like the kind that's got some energy. They got a little bit of humor. They're down to earth. I understand what they're saying, as in they're not using complex medical terms. They're explaining things. And I learned that a lot from social media.
Yeah. The other thing is too, so there is, this aspect of social media. It's interesting. Like, it can be very superficial too. And, if you go on the Instagrams and stuff like that, you see, doctors and, with their shirts off and like, different things. And you're like, okay, do you want that hot guy, or you want that guy, or that guy or girl that's, more about, taking care of it. And I'm not negating those Instagram people. I'm really not. I'm not trying to say anything, but, just because the other thing is, just because they have a presence on social media doesn't mean they're a good doctor either. So let's just go the other way too. So you got to remember what they're on social media and what they're doing. So definitely, I think social media is one of those. But again, like everything I just said, all those review sites, the Google, the WebMD and all this other stuff, health grades. Look at all of it as a whole. Don't judge the physician by themselves. Just by one review and go, oh my God, it's a horrible, it's a horrible thing. The other thing you can do as well is you can go on your state licensing board and make sure everything's okay there from a state licensing perspective. If they have a license, a board certification, you want them to be board certified, so you can check on that if they are board certified. Now, some of the older physicians are grandfathered in, so I'm not going to negate the older physicians at all in this scenario. Some people are just what we call grandfathered in, meaning they got board certified a long time ago, there's no requirements, and they said, okay, you're good. You see what I'm saying? You're 55 years old, you've been at it forever, you're good. But a younger physician myself has to recertify. So you can see if they're in good standing as far as certifications and all that good stuff as well too. And so that's another thing just to make sure about if you want. Now there's a difference between board eligible and board certified. The first 2-3 years I hadn't taken my board, so I was board eligible. Board certified is meaning you've taken the test and you've passed, and then after 10 years, 5 years, whatever the individual board's recommendations are, they're recertified. You see what I'm saying? So they continue to be board certified. So that's another thing as well too. As far as schooling, you can look into that if you'd like. I mean, some people are all about, my doctor goes to Johns Hopkins, my doctor's from Harvard, that kind of stuff. You can totally do that if you want, and if that's important to you. And you can, but I think what you really want to do is make sure you have a doctor that you connect with. That's the main thing, and has good communication skills. That's going to go you so much farther. Some of those really smart doctors that go to Johns Hopkins or Harvard, they're really good guys, and I know some of them, they're really good guys, not negating what they are, but they may be more academic based, or they may not be the best explainers, or they may not have the best bedside manner. So there's a lot of things out there that you can look for as far as personality types and different things. So, and I'm not trying to say I'm the best doctor either, James. Like some people may find me obnoxious. Like it's totally fine.
Some people find me irritable. They're like, I cannot stand your videos. I get those comments all the time. I'm like, hey, you can't please everybody.
You can't please everybody. So again, make that
and find what you click with.
Find what you click with. So that's a big thing too. So I would say that is a huge deal. And we talked about this before too. But make a list of your questions every time you go to the doctor. And let them know that I want to know about this, and this. You see what I'm saying? And that way, when you get there, you're not like, I thought I had something, but this way you actually are able to communicate what you need. And that's the big thing. And I feel like a lot of times the frustrations patients have is because of a misunderstanding or lack of communication. That's basically it. And so if you don't understand, like I'd like, one of the reasons I do my videos too is I really believe in patient empowerment. My channel is called Your Kidneys, Your Health, because it's your kidneys and your health. It's your ability to take care of yourself. So don't think of your doctor as like the end all be all overseer of your kidneys. He's just your consultant. That's all he is. Yeah, you know what I'm saying? That's it. Like you can implement what he does or not, but that's what I would say.
Yep. Could you move forward just a hair? You lean back.
Oh, sorry. I was getting so relaxed. I felt so at home, and so I just kind of backed up.
The audio level dropped. I tried to compensate, but I couldn't make it up quite enough.
Not a problem. There was a big comment right here. There was a big comment right there. I forgot it was National Kidney Foundation something. Someone just put it out
Dawn
there.
wrote. Well, first off, before we go to Dawn's, there was a hilarious one from Deb, a regular. I thought this was great. She wrote, I went to an ugly doctor that knows what he's doing. Way to go, Deb.
Oh, wow.
Now, that large one here from Dawn says, my nephrologist told me to go online to the National Kidney Foundation for stage 4 guide to the diet. He also said to watch sodium potassium, and that was that. Yeah, I kind of...
food-wise. So this is another thing you guys got to remember. So as doctors, and no doctors are going to admit this, we don't know much about diet. I'll be honest with you. We're not trained as dietitians. Now, some of us may act like we do, and some of us actually do take interest in diet. So I actually take interest in diet, and there are some doctors that do. But we're not fully suited to talk about diet. You really actually need to talk to a dietitian.
Yes.
One, because they actually do know more about specific things, but also they have the time to address your diet. Like you're in there with me in my 10, 15 minutes. I got to talk about your diabetes, your high blood pressure, your kidney disease, your phosphorus, your potassium. I got to talk to you about all these different things. I'm not going to have the time to sit there and say what you have for breakfast. You see what I'm saying? And like go over that. Now, sometimes I do not get me wrong. Sometimes I do go into detail about diet and stuff. But overall, if you want the most effective interaction as far as diet, guys gotta go see a dietitian. Okay. And that's where I'm not saying negating what that doctor told you. I really not, the other side is too, some doctor practices are so busy where they're just churning out patients and they're not getting a chance to actually interact with people. Do you see what I'm saying?
Yep.
And so that could be it. And it could just be that personality of that doctor too. They could just be kind of a cold demeanor, and that's how they talk, And again, that's where, if you didn't like that doctor, go find another doctor and see if you like them out there, The other thing is, other places, friends and family,
Yes. And coworkers.
Coworkers, yeah. Ask around and say, hey, do you know that? Or if it's not a PCP, any other doctor, just talk. If your whatchamacallit, your primary doctor is not that great, you don't have a good relationship, but your gynecologist, you love her, ask her what's the best kidney doctor you could recommend, or that's another good one there. So
I've never thought to ask my gynecologist.
Yeah, you can call your that's fine, man. It depends on the time of the month for you, James. It really does. It depends.
But I wanted to comment about the renal dietitian. Doctors, you're a nephrologist. Your specialty is the kidneys and all the things related to it. And a renal dietitian specialty is the diet. And it's important to go to a specialist for each of the things that you need. The guy who does my plumbing, I'm sure there are things he could fix on my car if they needed fixed. But I'd rather take my car to a mechanic for issues.
Oh, yeah.
And I'd rather my mechanic stick with the car and not show up and fix a leak that I have downstairs with my plumbing.
I agree. I totally agree. Like, exactly. Like, I don't want my cable guy fixing my sink, but he probably could. He's just. But yeah, like, it's just go to the specialist. And the thing is, guys, like, I would highly recommend you guys see dietitians as a whole, no matter what stage of CKD you are, kidney disease you are. Or even the fact that if you're not even kidney disease and you have diabetes or high blood pressure or anything else, I would just say go see a dietitian, especially if you're overweight or have issues there. Because if you were to address those problems of diet, we really have we don't have a diabetes problem, a high blood pressure problem, a kidney problem in this country, or a heart problem in the country. We have a diet problem in this country. And so if you actually got this talk to the dietitian, sit down and see what they say. You can see a renal dietitian. If you want. The thing is, he said my kidney doctor was great, except he never recommended a renal dietitian. You don't all have to see a renal dietitian, guys. You don't. Like, typically we refer to renal dietitians when the kidney function is less than 30. There's issues with potassium, phosphorus, all this other stuff. So if you're like CKD 3-ish, even 4, and your electrolytes are fine, we typically don't. So I would, in general, like, see a dietitian just for health purposes. So oftentimes I have a conversation with patients. Hey, you're diabetic and your diabetes is under control and you're obese. Let's go get you to see a dietitian. You don't just have to see a renal dietitian. You see what I'm saying, guys?
Yep.
You can just see a dietitian and get your weight in order, get your diabetes under control, which in turn help get that weight off you, which in turn helps your blood pressure and everything else. So that's key as well too. You don't have to see a renal dietitian. Now there are some issues with the renal diet. The issues with like high protein diets and things like that. Some people talk about, and even what we call plant-based diets. People are say plant-based diets do help the kidneys a little bit better. But again, this is where your individual actions happen. I can refer you to a dietitian all day, but are you actually going to implement those changes? You see what I'm saying? That's what I'm like. That's where my frustration comes in. It's like, dude, I sent you to the dietitian. Are you following what they said? I was like, no, not really, And I would have, can I make another suggestion about the dietitian? Make sure you have a recurring visit to dietitians. Don't just go one time. Don't go one time, and then just go like, oh, okay, she gave me a plan and that's it. And did you implement that? No. Make sure you have a follow-up with that patient, with that dietitian. And even if insurance doesn't cover it, if you care about your health, guys, you'd pay the $50-$100 or whatever it is to see that dietitian.
Exactly. And you may be able to use a health savings account or something like that if you have that.
Yeah, absolutely. So,
and my health savings account, it at first said, no, we're not covering dietitians.
Really?
So I just took the receipt. Yeah, they went and do the charge. not my health savings account, my insurance wouldn't do a dietitian at first. So I got the receipt and I just submitted it, and then I called them and explained it to them and was very persistent, and then they started covering up, and I used my health savings account for all my deductibles.
Yeah. Well, so like what's interesting, and this goes back to that video I just launched today, that 20-minute video about what they call value-based medicine. I think this is where a lot of the changes will be implemented, meaning like I'm thinking insurance carriers, including Medicare, are getting sick of this paying for dialysis, right? And cutting costs of dialysis. I think they really have to examine, paying for more dietitian and behavioral modification, behavioral change, and not giving a big fuss to a dietitian bill. You see what I'm saying? Like, and it's
exactly. And they're so small too. They don't charge that much.
No, they're not that expensive. They're really not. And again, some of them are really nice, and they have packages, and then you can get into, we went into the diet, but you can get into different diets out there, the keto, the paleo, and all these other ones too. But again, you can talk to your doctor, but also talk to the dietitian to see which diet is right for you. You may not want to go to that one that, is just like, I'm all this. You see what I'm saying? But maybe one that can incorporate different aspects of these other diets. So.
Yep. So what are some other tips?
Go ahead. So other tips. Okay. So as far as kidney doctors, what else? Family, friends, we talked about, referral from PCP, primary doctors, online searches. What else is there really?
So one thing a couple things that I found important when I was searching, and I recently just had to search again. My nephrologist, when COVID started, she left to be with her family in South Carolina, I believe it was. So I've been going without a nephrologist, but my primary care physician has been taking care of me. And I'm not at the point where I really need a nephrologist, because things are under control and I'm nice and stable. I feel great, but I have started looking for one just so I can start getting to know them, let them get to know me in case things start going down and I need to work with them. But I've been looking at availability. What days and what hours are they available, so that I don't always have to take off from work, as well as location. I don't want to drive 45 minutes. I found one and I was like, wow, great reviews. It looked perfect. They're on the other side of Dayton. So it's hour drive with minimal traffic. If it's during the day with traffic, it's going to be a lot.
So the other criteria I would ask too is like all these, like I'm sure they are now, but make sure these doctors have telehealth as well too. If you're a stable patient such as yourself, James, you're a telehealth visit. You see what I'm saying?
Yep.
So
that's what I do in my primary care.
So you guys want to make sure those doctors also have telehealth as well too. The other thing I would suggest too, I'm not gonna rag on the solo practitioners or two person, two guy practices, but you may want to be in a practice where they have all the ancillary support there. Meaning they have multiple nephrologists there, that if that doctor's not there, that someone else can cover him when he's on vacation, but also, that may have dietitians on hand, may have a dialysis unit there in the same building, have a vascular access center, like, at access we do in the same, in that same area, or have easy access to them. That way it kind of speeds up the process. You see what I'm saying? And I'm in one of those practices, that's 15 physicians. So at any one time, like any doctor can call me and say, hey, Cawsom, I need this done on this patient, and I can get it done. You see what I'm saying? And so those kind of things. Also, other thing is, if you're someone's getting admitted to the hospital a lot, you may want to make sure that that doctor has inpatient privileges. You see what I'm saying? So that doctor's not just an outpatient doctor, but he wants to go in and see you too. Now that or at least has someone in his practice that will see you. Do you see what I'm saying? So they're all in the same system, just because they can look at the clinic notes, get to know that person, and be like, hey, can I call my partner and say, hey, this guy's in here again. His kidney creatinine's 2. What was it last week? I was like, oh, look in the system. It's, so it's the same. You see what I'm saying? So that kind of ancillary support and kind of logistical support is really kind of helpful there. As far as, I think I would want there for them.
Yeah. And one other thing I do, and this is me being super nerdy, is that I try to have, if possible, and I went through this when I got my primary care physician, I try to do a phone appointment where I can somewhat interview them and kind of get an idea for their style. And it's booked as an appointment, so they're not, giving up their time or staying late to try to squeeze me in or anything. But I'll write down a few questions and I talk to them. And when I got my primary care physician, when I moved to Ohio, a big concern for me was the opioid epidemic around here. I had the perception that doctors were just writing scripts like crazy for opioids. And I did not want one of those doctors. I did not want to be on pills that I didn't absolutely need. I didn't want to be on pills forever. So I talked to doctors a lot about when do they prescribe medication? What are their goals if I do get medication at getting me off of it, weaning me off? And what are options outside of medication that they recommend? And my primary care physician said, first thing we do is we look at what you eat, your exercise, your health, all those things that you can do yourself. And we start there. If you need medication, we'll get you what you need. And if you can improve yourself, maybe you start exercise, you lose weight and things get better, maybe then we can get you off the medication. I don't want you to be on it for the rest of your life if you don't need it. That I liked. And those were the things that I was looking for.
So that's interesting because you want that in a doctor. I want that in a patient. You see what I'm saying? But I don't get to pick. So I get a lot of the patients that are just like, "What's the next med, man? What's the next medication, man?"
Now, some of the doctors that I interviewed thought I was looking for a doctor who was very loose with the pen.
Oh, is that right?
And I was like, no. I'm the opposite. Yeah. I want the doctor who's like, you know what? I could write you this prescription, or you could lose some weight and take care of this. Let's work on the weight first before I try the medication.
So that your phone call thing really brought something else into mind, and I totally forgot. You can actually, guys, look into the practice's website and look up that doctor. You see what I'm saying? And oftentimes they'll have a little bio on the doctor, little things that he likes to do and things like that, or whatever it is, and but also you may have an email or a contact form. So you may, if you guys are that type of patient like James, you may just want to fill out that contact form or that email and see that email of the doctor. Email that doctor saying, "Hey, I'm looking for a new doctor. I have kidney disease. I have stage 3. Just want to get to know you. Is there any way we can arrange a phone call, like a 5-minute phone call, just to see if you're a good fit?" I would happen to love that kind of email. Like, I would love that email. That would be super cool. An engaged patient that wants to reach out and get to know him before you make that visit all the way downtown or whatever it is. Now, I've had those patients too that just wanted a second opinion. I remember one particularly as a patient that had a VA doctor, just wanted a second opinion, came to me. I think he liked me, but he didn't come back. Because he just was comfortable with the VA system. You see what I'm saying? So he didn't come back to me or whatever. And, he may have actually liked that VA doctor better. Who knows? But he was fishing for a new doctor. And that was a completely benign experience. And, it was fine. So those are other options. Do not think you're stuck with whoever doctor you got referred to by Joe Schmo or whatever it is. To make sure you keep those options open.
Yeah, because like we said in the beginning, it's all about that relationship you've developed with the doctor. You got to feel comfortable. You got to trust each other. You got to be able to communicate well. All of that is really what makes finding a good doctor a person who can actually help you. Because if I don't really care for you, I'm not going to do the things you say. I'm not really going to pay attention.
Yeah.
You're going to say, "Hey, look, you got to cut your sodium." Oh, yeah.
Yeah, so I have a problem with the cutting the sodium thing and just random. Like, you have to actually back it up with something else. You have to actually. That's where the doctor has to be a little bit more explicit. And I've actually really got into this. I'm part of a startup called Telehealth, and they talk about learning science and how you engage patients to make sure they learn and stuff. It's so cool. So there's like a science to it too, and that's what I've noticed just by doing videos. And I'm sure you've noticed here. People engage in different manners, in different ways. And so, but the thing is on guys, like, I always want you to remember, this is a two-way street, really is. So if you're engaged, I'm engaged. You see what I'm saying? Maybe, me and James are kind of outgoing a little bit, whatever, but, and we like to be engaged, but some people need to be coaxed into it. So maybe a nephrologist needs to be coaxed into it. So maybe you got to be the one, "Hey, how's your family doing, doc? How's life? How's my kidneys doing?" Just just engage in that conversation. And all of a sudden, you will always do more for people you like. Okay. So like, it's just a fact. So if you make me like you, for whatever reason, tell a funny, stupid joke, a dad joke, or whatever it is, or just, engage, I will probably go out of my way to help you even more. So again, don't just think it's a one-way street here. This is, again, when we talked about relationship goes two ways, right? I sound like a marriage counselor right now. Like I need to stop. Like I seriously need to stop.
Well, but it's so true. That's what it all comes down to. Do you like, and when I was in the ICU, the nephrologist, her and I just did not get along too well. Now, first of all, I'm sick. I'm not feeling well. I didn't want to meet anyone new. I didn't want to hear everything that came out of her mouth was bad news. It was all honest, though. So I wasn't ready to kind of get to know someone new to tell me how sick I was. But it really came down to I needed to find someone that I felt comfortable with, that when they spoke, I wanted to lean in and listen. I wanted to take notes and do those things because I felt like they had my best interest in mind and they were honestly trying to help me. To me, the doctor's a coach, the coach of the team. And I need their guidance, their experience, and then I'm the one who has to execute on that. They give me the pills, take these in the morning every day. I have to execute on that. Exercise more, eat better, take your blood pressure and write it down so that I can see it. I'm the guy executing that. They're the coach, and we got to get along really well.
So I just had a question on my social media when I shared it on Facebook. It's just like, in most cases, do you need a doctor's referral to get a nephrologist, or is it easy just to call the office? I would say it depends on your insurance policy, right?
Yeah.
Sometimes you have to get a referral from your PCP, and sometimes you can go directly. Now it depends on you guys. Again, like you can go directly too. Just make sure you have kidney disease and that it's or kidney issues before you go. I've had people come into me for back pain, literally back pain, because they thought it was their kidneys, and everything was fine. So that's why the PCP is a good gatekeeper in that scenario. But if you have kidney disease, contact your insurance company just to make sure. But you can usually directly contact a nephrologist yourself as well too. And then if you can't, you may just want to get who's in network for your insurance. Do you see what I'm saying?
Yeah.
That's a good thing to know too.
The insurance website probably has a search feature that allows you to search by specialty, so you can pick a nephrologist and find someone.
Yeah, absolutely. So, but yeah. And then the other thing you may want to know too, what I've noticed is I've worked with another company, and so sometimes doctors have aliases or different names, so like Kenneth may go by Ken, or Steven may go by Steve. And so their social media or like Google search is not the same. So that may be some causes of confusion as well too, out there too. So just be aware of that. That can happen sometimes. And if you're in like a San Antonio where there's 60 Dr. Gonzalez's, you may want to
you don't know
specify
which one's which. I understand that name confusion, because I go by James at work. I go by James here. But, when I was dating, it was Jim.
Stephanie? Was it?
So,
it was Stephanie.
So my wife knows me as Jim. Her family all knows me as Jim. And it gets confusing. My wife has to remember when to go back and forth between James and Jim, because if she uses the wrong name, people will be like, who?
Wow. Hey, guys, let's just all call him Jimmy. I want to call him Jimmy.
Hey, that's what my name used to be, Jimmy.
Oh, Jimmy.
So at work, now I go by my last name, because when they say James, you don't know which one. So everyone's like, hey, go see Fabin. He'll take care of it. So then they know who I am.
Oh, yeah. That sounds cool. Fabin will take care of it. Yeah.
Yeah.
That sounds like an Avenger, dude. That sounds like an Avenger. Fabin.
Ooh, awesome. There we go.
So,
but I think we've covered everything, at least it's on my list. And I think we've got everything that's on your list.
Absolutely. Yeah.
Yeah, and don't be shy to ask questions of the doctor when you're looking for one. And if you are someone who's not as outgoing as myself or Dr. Butt, the email approach could be great. Writing down a few questions, get their email them, let them know, hey, I'm looking for a new nephrologist. I want to, ask you a few questions to see if we click.
Yeah.
And, shoot them that email and see if that'll help start that conversation and get you
And I always start that
comfortable.
And guys, in that email, make it like, a few sentences. Don't make it like your whole life story. As a child, I had difficulty peeing. Just start I got CKD, man, and I just want to know you and get to know you if I heard your good things about you. And then go from there. Something simple and straightforward. Don't go, because I've actually gotten those emails where it's like 6 paragraphs and I'm like, dude, I didn't need your autobiography. It's just like, so just make sure it's a subtle email, just quickly, and go, hey, can we talk? And I think most doctors will be very, very willing to talk to you.
Yep. All right, so we have a few minutes left. Can you answer a couple questions that we have in here, Doc?
Sure, let's go.
All right, here's a good one. John asked, what's the difference between microalbumin and
proteinuria?
Yeah.
Proteinuria. Okay, so microalbumin is like a different type of protein than, say, a specific type of protein versus a protein. Microalbuminuria is typically in the range of 30 milligrams to 30 micrograms to 300 micrograms. That's called microalbuminuria. So that's a little bit of protein spillage, but it's micro. After 300 micrograms, it becomes macroalbuminuria. And then typically you go, when it's above that, we typically do proteinuria measurements, and that's how we want to do it. And you got to remember, in a day, you want to lose less than, say, 300 micrograms or less, or actually less than that of microalbuminuria. Sorry, let me repeat that. Microalbuminuria is between 30 and 300 micrograms. Okay, so that's a little bit of protein spillage. Protein spillage as a whole is usually less than 150 milligrams of protein spillage. So that's the difference there. It's a very subtle difference. But again, microalbuminuria is a little bit of damage, likely from diabetes, if you're getting that test taken. And macroalbuminuria is greater than 300 micrograms, at which point you usually switch to proteinuria measurements, urine protein creatinine ratios. And I've actually had that question. I actually did. If you noticed recently, I've given little guidelines of what to ask doctors and
yes.
how do you know kidney. I don't know if you found that informative. Did you find that informative? Like, when does dialysis start and stuff like that?
Always informative. Anything that comes from a good source that has information is always helpful. Yeah, I saw that earlier today in a few of the groups on Facebook.
So I did one specifically about protein. What to ask your kidney doctor. Yes, that's what I did. That's where it's from.
There we go.
I did like a little post that I made a graphic about what to ask your kidney doctor every time you see him. You guys may want to look it up on my Facebook. But it's one of them was my proteinuria less than 150 milligrams, right? And then somebody literally posted their labs or something, I think, at one point. And I was like, how come the ratio and all this stuff? And the ratio, it's the ratio that matters, not just the protein in the urine, but the ratio to creatinine. So that's what matters as well too.
Yep. So what are your feelings on keto and keto analogues?
Ooh, so
we've got someone here. Looks like they're stage 4 or 5.
So so this is a really complex issue, and where you have to not just about keto, it's about you as a person, and it's about you being a diabetic, hypertension, heart disease, and all this other stuff. I do not, so if you go straight keto and you're on diabetic medications and you're not taking any more sugars, your sugars may just tank. Do you see what I'm saying?
Yep.
So you got to be careful about that. So keto is typically less than 50 grams of carbs a day or 30 grams of carbs a day?
I think it's 20 or something around there. Yeah.
Yeah. So
it's very, very low.
Very low. It's very difficult to maintain. So you got to remember, I really believe that you should start a diet that you can maintain for the long run. So keto, there are some evidence that it is beneficial. Do not get me wrong. But can you maintain keto and be in ketosis for the rest of your life? Probably not, right? So I like to extract tidbits from different diets. So keto, I would definitely extract lower carb for sure, but also not as low carb, but also healthier fats, avocado, olive oil, coconut, all these healthy fats. Incorporate those into your diet as a calorie source, as a higher calorie source than, say, carbohydrates. That's something I would definitely try to incorporate. The thing is, if you're making that transition and you're diabetic, you may want some support from your doctor or endocrinologist that can help you make that transition into it. Okay. As far as kidney health, It's high fat, not high protein. High protein is like Atkins. So Atkins, you may not be advisable, especially animal fats. Animal fats are deleterious to kidney health as opposed to plant-based proteins. Yeah, those are okay. So if you're going to implement that kind of diet, I would talk to your doctor, or your kidney doctor, and your whatchamacallit, and your endocrinologist,
Renal your dietitian. Yes.
And get a dietitian. I've seen people try to do keto on their own. Get a dietitian that knows what they're doing, and knows kidney patients. You see what I'm saying? Mm-hmm. So if you're going keto, don't just follow a random keto person online. Get someone that knows kidney patients and is implementing keto and knows how to do it. So.
Yeah, and with keto and kidney patients, that is something not a lot of renal dietitians are experienced with, but the Kidney RD, Jess and her team of renal dietitians, have a keto program for kidney patients, because it's really got to be customized for kidney patients, and if you're diabetic, that throws a whole nother wrench into it.
Absolutely. So you're complex. So you want to make sure you have the help. Again, what I said earlier, you need to have a good BS filter. Okay. Yep. Just because he or she has a 6-pack on Instagram does not mean they know how to implement a diet, right? Try to get in there and know, hey, I'm a kidney patient. I'm a kidney patient, and I want a dietitian that knows kidney patients and knows keto. Again, I'm not recommending keto. I'm not necessarily recommending it.
Yep.
But go see a dietitian about kidney health as a whole and see what they say first. So.
Now here's another great question, and I get this all the time, and actually would be a great video. What are ways that you know of to help kidney patients reduce the amount of protein they're leaking in their urine?
Ooh, that's a good one. So protein in the urine. So I would now this is where the high protein diet, animal fats come in, so that can cause more splitters. So I definitely would advise more of a plant-based diet. And guys, when I say plant-based diet, I'm not saying go full vegan or vegetarian. I'm saying eat more salads, fruits, vegetables, things like that, and get less meats in your diet. That's one thing. The other thing I would definitely do is make sure that you are on what we call an ACE or an ARB, medications that end in pril, lisinopril, enalapril, or artin, losartan, valsartan, those kind of medications. Those reduce protein in the urine as well too. So those are things you can do to actually make sure you reduce the amount of protein in your diet. So decrease protein in animal fats, and definitely add the ACEs and ARBs to make sure you're on an ACE and ARB. Now, some patients out there, by the way, James, they may be CKD4 or even late stage CKD3, and they're like, my doctor doesn't have me on lisinopril or an artin or an ARB or one of those medications, and you're like, oh my God, he's a bad doctor, right? No. Sometimes what those medications do is actually increase your potassium. And so in late stage CKD, your potassium goes high. So it goes high, right? So I can't, if I add a lisinopril or ARB, it can actually raise it higher. So some of my CKD patients, even though I want them to be on those medications, I cannot put them because their potassium is too high. So that's another problem you can encounter.
Yeah, and I was on losartan, and they took me off of that right away in the ER. And now I'm on a giant cocktail of a whole bunch of different pills. But my blood pressure's been under control for over 2 years now. Now, next month, I'm going to work with my doctor to try to get me off of Clonidine. Is that it?
Clonidine,
yes. I take it in the morning and in the afternoon. And the sleepiness is just, I'm done with it. I'm still taking it, but I'm like, look, doc, let's try to find another combination that works. So we're going to work together starting next month when I go in person for a visit for the first time since COVID started. It's all been telehealth in the past, and we're going to work on trying to get me onto some other blood pressure medication. But I'm one of those ones that's not on a Stan or the other one, either of those.
Pril. Yeah.
And it's just because we're all different.
Yeah.
All right, let's see. I had one other question in here. A lot of people were mentioning what medication they're taking.
They're giving a shout out to their meds, to Big Pharma. They're giving a shout out to Big Pharma right now.
Let's see. There was one other one. Oh, Shirley. This is just she mentioned she was diagnosed with stage 4, which is pretty serious, Shirley, and her doctor has not recommended a specialist. Should she take her health more serious?
Oh yeah. Okay, so depends. Does she mean a specialist, meaning a nephrologist? She hasn't been seeing a nephrologist, right?
Yeah, I'm assuming that's what she's meaning, that her primary care physician, I'm going to guess, has done some labs and gave her the results.
So I would definitely recommend you see a kidney doctor. Now, depends on the primary doctor. What I've noticed, the older school primary doctors, they like to handle CKD on their own, and they refer late. The problem is when we refer late, I can't do anything for you, dude. Like, once you come to me at CKD 4 or 5, I've actually had people with almost edge of dialysis, and I'm like, hello for the first time. And
that was me. You know? I ignored the symptoms for at least several weeks. And I saw a doctor because I was in the ICU. Otherwise, I wasn't having anything checked.
Yeah. So, I would definitely go see one. Now, sometimes it depends on the person. I'm not saying you shouldn't see a doctor by any means, but sometimes if they're like 90 and CKD 4 and a lot of things going on, the doctor may just try and save that person time by not, going to a doctor. Or maybe she's in a town that's she's 300 miles away from a nephrologist. That's another thing too. So there's a lot of things going on there. Now, if that person's in a town in reasonable health, doing okay, I would definitely go see a nephrologist just to make sure you're what's going on with your kidneys. And even if, say, like that kidney function has been stable, GFR of 25 for 5 years, and you're fine, I would still see a nephrologist just to make sure it stays there. Sometimes it's just serendipity that the reason it just stayed there. You want to make sure it does stay there. Knock out any meds that could hurt it and things like that. So.
Yep. All right, Doc. We are coming right up on the top of the hour. I want to thank you so much for your time. Always great to have you here. And everyone else, make sure, check out his YouTube channel, Your Kidneys, Your Health. Subscribe. Over 1,000. Awesome. Now you got to catch up with my channel. Let's get
just 100 times more. That's all.
Let's get everyone from Dadvice TV to also subscribe. It's free. You can subscribe to as many channels as you want. Hop on over, subscribe to his channel. Lots of great content. And if you haven't subscribed to Dadvice TV yet, go ahead, click it. Click the little bell icon, and every time I do a new video like these ones, you'll get a notification so you won't miss anything. All right, everybody. Absolutely. It's been great having you guys here, and we'll see you in the next video. Bye, everyone.
Take care, guys. Bye.